What's up, guys? Dr. Luke here with Dr. David. As promised, Curiosity Corner's back, and David here has some elbow pain.
Yeah.
What happened, David?
Well, I hit it really hard going into the new year. Got back to the gym, started doing a bunch of pull-ups, and now my elbow is killing me.
Yeah.
Can you help me?
Yeah. We're just gonna stick a bunch of needles in there. No, no, that's part of it. I would say this is a very common complaint. Obviously, David doesn't really have elbow pain, but we see this quite often with people coming in, especially here in the new year. They've been going hard with their new workout plan, their New Year's resolutions, and they've been doing a bunch of grip work, maybe pull-ups, maybe they're curling a lot, maybe they're playing even paddle sports as we talked about in the initial video, but they've had some acute inflammation going on somewhere in the elbow. And we would initially do a nice, good evaluation, but let's say that we're pretty sure it's coming from some irritation here where the tendons of the forearm kind of come in here and attach up on this bone here. And we call this, might commonly referred to as lateral epicondylitis, all right, or tennis elbow. So, one of the common ways that we'll treat this here in the clinic, initially the body's tendency is to contract the muscles and really try to protect the area. So we'll hold a lot of tone through those muscles, and that can increase some of the tension through there. I develop trigger points, either they're latent or active, and some of these active trigger points can refer pain up and down the elbow. So we might start with David here. I might poke around some of these forearm muscles that have been overused, and they're tender, they're sore. I can feel a little tone and maybe trigger points in there. And what I'll do is I'll use some dry needling. And we've talked about dry needling in other videos, but David goes ahead and lay down. What I'll do, is I'll prep him for some dry needling over that forearm. All right, so this area tends to respond well to some needling, and this way right there so people can see. And we usually get a nice twitch response from the muscles in the area. So we like we also talked about, we want to really have that conversation around how to maybe modify the amount you're using that arm over the next couple weeks, so that you can really kind of decrease the amount of inflammation sensitivity in the area. But for David here, what I'll do is kind of find areas of the muscle that may be tight. I might see them wince. Go in there with the needle.
Ooh, yeah.
See a little twitch response there. And pull it out. All right.
That's it?
So we'd probably do a couple more areas where we'd find restrictions. But what I tend to like to do is follow up the dry needling with what we call instrument-assisted soft tissue mobilization, or might be commonly referred to as a Graston Technique. Essentially, this some people will say this is a way to rub out knots. I like to think of it as a way to kind of desensitize the area, bring blood flow, kind of switch out the inflammatory soup in the area. All right.
Feels pretty good.
Yeah, great. Feel better already?
Yeah.
You're fixed. No. This isn't something that's fixed overnight. Typically we needle, do this for 5 minutes maybe around the different muscles that have restrictions. And then when I'm done with that, I kind of have David sit up here. All right, just kind of move it, see how it feels. Maybe do a nice little forearm extensor stretch there. Yeah. And then we would go into something like some wrist extensor, some strengthening here through the wrist extensors, where we get some nice resistance. He's got a band there, and he's gonna go in loading those extensors now that we've kind of treated it. All right. Obviously, this is kind of the baseline where we start to work, and we progress them back to lifting, pull-ups, and those types of things once his symptoms kind of start to decrease, and give him a lot of education on what to expect throughout the day. So, that's one of our treatment approaches here at RecoverRx. We think that that's really following some of the best literature out there, and in our experience, kind of a great way to get people back to the gym.
For sure.
And, we feel like if you're not kind of receiving that style of care, reach out to someone that's going to provide that for you. So, we hope you enjoyed this educational video. We hope to keep, providing these types of videos for you guys. The Curiosity Corner, where we just provide education on some of these different questions that we get in the clinic here, and so that you guys can have an idea of what to look out for when you might be experiencing some of these symptoms.
For sure. If you're curious, leave us a comment, and we'll happily kind of delve into what's on our mind lately and how we can help you out in the clinic.
And if you can't see David because he's wearing his camo shirt,
I want to make sure everyone could see me.
Awesome, man. Awesome. Well, thanks for checking in, guys.
Have a good one.
Be on the lookout for the next video. Take care.